of the NEET PG important questions, we will discuss about the questions of the topic arm and cubital fossa. So first try to answer the question by yourself. Lateral and the medial intermuscular septum are derived from brachial fascia. Medial and the lateral intermuscular septas or septums are well defined in the lower one-third of the arm. Medial intermuscular septum is attached to what part of the humerus? They are attached to the medial supracondylar ridge in the lower half of the humerus and the medial epicondyle of the humerus. Medial intermuscular septum is pierced by ulnar nerve, superior ulnar collateral artery and the posterior branch of the inferior ulnar collateral artery. Just above the medial epicondyle, the medial intermuscular septum is pierced by posterior branch of the inferior ulnar collateral artery. Medial intermuscular septum in the middle of the arm is pierced by ulnar nerve and the superior ulnar collateral artery. Lateral intermuscular septum is pierced by radial nerve and the radial collateral branch of the profunda brachii artery. Radial nerve pierces the lateral intermuscular septum at the junction of the upper and the middle one-third. Coracobrachialis is pierced by musculocutaneous nerve. What is the action of the coracobrachialis muscle? It causes the flexion at the shoulder joint. Musculocutaneous nerve supplies which muscle? It supplies the biceps brachii, coracobrachialis and the brachialis muscle. When is coracobrachialis muscle supplied by the musculocutaneous nerve? Before piercing the muscle. Coracoid process gives attachment to which muscle? It gives attachment to the biceps brachii, coracobrachialis and the pectoralis minor muscle. Insertion of the coracobrachialis muscle on the humerus is at the middle of the shaft of the humerus at the medial border. What is the origin and the insertion of the biceps brachii muscle? So, long head of biceps brachii muscle originates from the supraglottal tubercle of the scapula. Short head of biceps brachii muscle originates at the tip of the coracoid process, and the insertion of the biceps brachii muscle is at the posterior surface of the radial tuberosity. Now, what are the action of the biceps brachii muscle? So, they stabilizes the shoulder joint during the abduction. They cause the flexion at the elbow joint and cause the supination at the radio-ulnar joint. Brachialis muscle is supplied by which nerves? By the musculocutaneous nerve and the radial nerve. Brachial artery is continuation of axillary artery at the level of lower border of the teres major muscle. Which nerve crosses the brachial artery from the lateral to the medial side anteriorly in the middle of the arm? So it is the median nerve. In cubital fossa, brachial artery is crossed anteriorly by bicipital aponeurosis and the median cubital vein. Which nerve is lateral to the brachial artery in the upper part of the arm? So it is the median nerve. Which nerve is medial to the brachial artery in the lower part of the arm? So it is the ulnar nerve, medial cutaneous nerve of forearm. Nutrient artery to the humerus is a branch from the brachial artery. Superior and the inferior ulnar collateral arteries are the branches from the brachial artery. The brachial artery divides into ulnar and the radial artery at neck of the radius. Musculocutaneous nerve continues as which nerve? It continues as the lateral cutaneous nerve of forearm. Median nerve leaves the cubital fossa and enters the forearm at between the humeral and the ulnar head of the profunda teres muscle. Describe the anastomosis at the elbow joint. Okay, so as you can see over here, this is the elbow joint. So in the front of the lateral epicondyle, this is the lateral part and this is the medial part, right? So in front of the lateral epicondyle, there is anastomosis between the anterior, this is the anterior descending branch of profunda artery, the profunda brachii artery. Okay, so in the front of the lateral epicondyle of the humerus bone, there is anastomosis between the anterior descending branch of the profunda brachii artery. Okay, and this radial recurrent artery. Okay, now next is the behind the lateral epicondyle. So behind the lateral epicondyle, there is anastomos between the posterior descending branch of the profunda brachii artery, okay, and the interosseous recurrent artery. So in front, the antedescending and the radial recurrent artery, okay, and behind the lateral epicondyle, there is anastomos between the posterior descending and the this interosseous recurrent artery, okay. And now in the front of the medial epicondyle, there is anastomos between the anterior branch of the inferior ulnar collateral artery, this one, okay, and the anterior ulnar recurrent artery. And behind the medial epicondyle, there is anastomos between the superior ulnar collateral artery and the posterior branch of the inferior ulnar collateral artery and the posterior ulnar recurrent artery, okay. Now next is radial nerve in the profunda brachii artery remains in the spiral groove on the posterior surface of the humerus between which muscles? So between the medial and the lateral head of the triceps muscle or tricep brachii muscle. Radial nerve after piercing the lateral intermuscular septum runs between which muscle? Between the brachioradialis and the extensor carpi radialis longus muscle. Which muscles are supplied by the radial nerve? Triceps, anconeus, brachioradialis, supinator, ECRL and the ECRB, extensor digitorum, extensor carpi ulnaris, abductor pollicis longus, extensor indicis, and the extensor pollicis longus and the extensor pollicis brevis are supplied by the radial nerve. Radial nerve in axilla supplies which muscle? So it supplies long head of triceps. Which muscle stabilizes the shoulder joint during the abduction? Long head of biceps and triceps stabilizes the shoulder joint during the abduction. Radial nerve reaches the spiral groove after passing through which intermuscular space? Lower triangular space. Radial nerve in the spiral groove gives which branches? It gives articular branch to the elbow joint, lower lateral cutaneous branch of the arm, posterior cutaneous branch of the forearm, and also supplies the lateral head of triceps, medial head of triceps, and the anconeus muscle. Cylindrical shaft of the humerus becomes triangular at which part of the arm? So, at the middle of the arm, the cylindrical shaft of the humerus becomes triangular. What else important things are seen at the middle of the arm? So, insertion of the coracobrachialis muscle and the deltoid muscle, nutrient foramen of the humerus, median nerve crosses the brachial artery from the lateral to the medial side, and the ulnar nerve and the superior ulnar collateral artery pierce the medial intermuscular septum over here at the middle of the forearm. Now, what are the boundaries of the cubital fossa? Now, as you can see over here, this is the cubital fossa. Okay, and the boundaries of the cubital fossa are basically three: medial boundary, lateral, and the superior boundary or the base. Okay, so first of all, the medial boundary is actually formed by the lateral boundary of the pronator teres muscle. Okay, the lateral border of the cubital fossa is actually formed by the medial border of the brachioradialis muscle, and the superior border or the base is actually an imaginary line between the medial and the lateral epicondyle of the humerus bone. Okay, so medial boundary by the pronator teres muscle, lateral by the brachioradialis, okay, and the base by imaginary line from the medial to the lateral epicondyle of the humerus bone. Floor of the cubital fossa is actually formed by brachialis muscle and the supinator muscle. Roof of the cubital fossa contains what? It contains the skin, superficial fascia, deep fascia, bicipital aponeurosis, median cubital vein, medial and the lateral cutaneous nerve of forearm. Now, what are the contents of the cubital fossa? So, it contains from the medial to the lateral side or the medial to the lateral direction as median nerve, brachial artery, tendon of biceps, and the radial nerve from the medial to the lateral side or direction. The radial recurrent branch is given by the radial artery in cubital fossa. Larger terminal branch of the brachial artery is the ulnar artery. Which branches of the ulnar artery are given in the cubital fossa? So they are common interosseous artery, anterior ulnar recurrent artery, and the posterior ulnar recurrent artery. Radial nerve in the CUBITAL fossa passes between which muscle? It passes between the brachialis and the brachioradialis muscle. Deep branch of the radial nerve passes between superficial and the deep fibers of the supinator muscle. Radial nerve divides into deep and superficial branch at the level of lateral epicondyle. Deep branch of the radial nerve is called the posterior interosseous nerve. Posterior interosseous nerve in the cubital fossa before entering the supinator muscle supplies which muscles? It supplies the supinator and the extensor carpi radialis brevis muscle. So today up till here we'll discuss about the further important notes and questions of further important topics in our next video. Thank you so much.